Welcome back, everyone. Tonight in Medical Rounds, it's the second leading cause of cancer-related deaths among men and women combined here in the U.S. Yet 1 in 3 people are actually not up to date when it comes to colorectal cancer screenings. And we are very happy right now to be joined by Dr. William Sardella, a colorectal surgeon at Hartford Hospital, to talk more about the importance of getting routine colonoscopies. Hi, Dr. Sardella. Thank you very much for joining us tonight.
Good evening.
Well, let me ask you first. Obviously, I think people get nervous when they hear about this, so let's talk about a colonoscopy itself. It's actually easier than I think a lot of people might think. So talk about the process, if you could.
So colonoscopy is an examination of the colon using a flexible scope. I think most people fear the preparation the day before, which is required in order to get an adequate examination. However, there are many different preparations available today, and I think most people will find that they're quite palatable and much easier to take than they were in the past.
I have to admit, I had my first one last year. It was not nearly as bad as I thought it would be. Obviously, the goal here is early detection of polyps, and colon cancer is so vital. If caught early, how effective can treatment be?
So if colon cancer is diagnosed early in its earliest stages, it could be treated with surgery alone and cured in more than 90% of cases.
That is certainly some good news. Describe the stages, if you could, of colon cancer, also the prognosis of each stage. Obviously, I would think the further along it is, the worse the situation, right?
Correct. In the earliest stages, stage 1 and 2, there were 4 different stages in total. Stage 1 and 2 means the tumors are confined to the colon and can be treated with surgery alone and don't require any further treatment subsequently. If the tumor cells have spread from the colon into the adjacent lymph nodes, that would be stage 3. That can be cured with surgery, but also requires chemotherapy postoperatively. Stage 4 disease is the most advanced stage, with tumor cells have spread to other organs in the body, and in most cases that typically would require chemotherapy.
Lastly, doctor, talk about some of the treatment options. You mentioned chemotherapy right there, but what are some of the options for those with colon cancer?
So treatment options, the mainstay of treatment is surgery for stage 1 through 3. So surgery can be curative in many cases. As I've mentioned before, in stage 3 disease with positive lymph nodes, then chemotherapy would be used after surgery to help reduce the risk of recurrence. Stage 4 disease, initial treatment typically is chemotherapy, but surgery would be used in some cases depending on the patient's symptoms and the problems the tumor might be creating locally. My partners and I here at Hartford Hospital have an extensive experience with minimally invasive surgery, which we use for colorectal cancer, and typically most of our patients do extremely well and recover quickly and uneventfully.
Okay, the bottom line, doctor, I would imagine, get that colonoscopy. Don't be afraid. Get it done. It could save your life.
Absolutely.
Okay.